Good day, everyone. This is Group 3, and our topic is atherosclerosis. The members in the group consist of Sarita, Kendra, Wayne, myself, Aaron, and Crystal. So what is atherosclerosis, you may ask? This is a narrowing of the arteries caused by a buildup of plaque. Arteries are the blood vessels that carry oxygen and nutrients from your heart to the rest of your body and all that stuff. As they get older, the fats, cholesterol, and calcium can collect in your arteries and form plaque. The buildup of plaque makes it very difficult for blood to flow through your arteries. This buildup may occur in any artery in your body, including around your heart, legs, brain, and kidney. A brief history on atherosclerosis is that it was invented by the German physician Felix Marchand from the Greek words, I believe, ather and scleros, ather meaning cruel and scleros meaning hard. Atherosclerosis is a chronic inflammatory disease of the inner wall of large and medium-sized arteries. Arteries most commonly affected include the aorta, the carotid artery, the coronary arteries, and arteries of the lower extremities. Atherosclerosis is the primary underlying cause of many heart diseases, and I think it has been identified as a threat to mankind since before 3000 BC. So following extensive investigation of mummies of the old world, thorough microscopic examination of the vascular system of mummies found in Egypt, I believe there was evidence of atherosclerosis in the aorta and I believe the femoral arteries as well. Therefore, one may conclude that even though the terminology of atherosclerosis is recent, the disease itself is ancient. And what are the causes of atherosclerosis?
Although atherosclerosis is considered a heart problem, it can affect arteries anywhere in the body. The hardening of arteries occurs over time, so aging plays a big factor here, and it can begin as early as childhood. Some causes of atherosclerosis include high cholesterol, high triglyceride levels, lack of exercise, and smoking tobacco. Risk factors. Moving on to risk factors. The risk factors for plaque buildup are often linked together. Some risk factors include high blood pressure, which over time can damage the artery walls, allowing plaque buildup, diabetes, which damages the inner layers of arteries, also allowing plaque buildup. Family history may have caused a common inherited cholesterol disorder, and inflammatory diseases such as rheumatoid arthritis and psoriasis can cause high levels of inflammation that irritate the blood vessels, leading to plaque buildup. On to the next slide.
And
Okay,
what are some of the symptoms?
Sorry. Right, so symptoms, right? So some of these symptoms may not occur at the beginning of the disease, right? So the symptoms would and with time then would start to show. So this is when our body is in need of oxygen, because atherosclerosis is kind of depriving our arteries from oxygen. So some of these symptoms associated with this disease would be like chest pain, cold sweat, dizziness, extreme tiredness, heart palpitations, shortness of breath, nausea, and weakness. So these symptoms would be for if you have a atherosclerosis in the coronary artery. For the peripheral artery, the symptoms include like pain, aching, heaviness, cramping in the legs. Like this is an example, like when you're walking or climbing up a stairs. Well, these symptoms can also go away after your rest. Now for the vertebral artery, some symptoms would be problems with thinking, memory, weakness, or numbness to one side of the face. Also, you can have like vision troubled, and we can also have like a transient ischemic attack, and this is also commonly called like a mini stroke. It's a more serious symptom. And then for severe pain following meals, weight loss, and diarrhea as symptoms of the mesenteric artery. So we have like the stages here of atherosclerosis. So for the first diagram, you would see this is what a healthy artery looks like. And then you would see now, as if for the second one, the artery wall start to come down a little bit thinner. And then for the third one here now, this is where like the plaque start to form. So you're seeing all the yellow substance inside the artery, that is basically the plaque forming. And the last diagram is because the plaque forms now, it and it has a hard substance. This will cause like the blood now running through to build up pressure. This causes blood clot to form. So you can see there now the blood, it cannot pass through now the artery, so hence a clot will be forming on that side. Right, so now we can look on here on the left-hand side here, we have a normal human artery. So we've seen that the endothelium is in place, in line. The smooth muscles are also compact. And then we can see now on the other side here, this is when atherosclerosis occurs in the arteries. So we've seen that the endothelium now, they are damaged. So you see they moved out of their lining. Also, these smooth muscle cells, they move from the compact area they are, and they go into the area where the plaque is. The plaque is the area where the lipid and calcium form. So you see that bumpy kind of area there. That is where the plaque is forming. So you see that they cause like a fibrous cap to form there. And this now will cause the walls of the artery to thin and will cause the blood now to have difficulty flowing into the arteries. So now we will have like Keandra with the pharmaceutical treatments.
Treatment entails lifestyle changes like eating healthy and exercise. That may be all that you need to treat as atherosclerosis, although surgical procedures may be needed sometimes. Many different drugs are available to slow or even reverse the effects of it. For example, some medications are statins and other cholesterol drugs. Low-density lipoprotein cholesterol, the bad cholesterol drug, can slow or even reverse fatty deposits in the arteries. Aspirin. This thins the blood, preventing blood clots. Low doses of aspirin therapy may be recommended for heart attack prevention or stroke in some people. Blood pressure medications. These lower the blood pressure but do not reverse atherosclerosis. Instead, they prevent or treat complications related to the disease. And now we're going to the surgical.
All right, so sometimes more aggressive treatment is needed to treat atherosclerosis. If you have severe symptoms or blockage, you may need a procedure or surgery including angioplasty and stent placement. This procedure is also called cutaneous coronary intervention, or PCI, which helps a clogged artery or a blocked artery. A long flexible tube, which is basically a catheter,
is inserted into the blood vessel, usually in the groin or wrist, and guided to the blockage. Then a balloon on a tip of a catheter can be inflated to open the artery, after which a mesh tube or stent is typically used to keep the artery open. In atherectomy, sometimes surgery is needed to remove plaque from the walls of a narrowed artery. When the procedure is done on arteries in the neck or the carotid artery, this is called a carotid endarterectomy. Then we have fibrinolytic therapy. If a clot in an artery is blocking blood flow, your provider may use a clot dissolving drug to break it apart, such as basically aspirin. Coronary artery bypass graft, or CABG surgery. A surgeon takes a healthy blood vessel from one part of the body to create a new path for blood flow in the heart. The blood then goes around blocked or narrowed coronary artery. CABG is an open heart surgery. It's usually done only in those with narrowed heart arteries.
So as we come to the end of our presentation, I hope we educated you on the disease atherosclerosis, and we thank you for your time.